Hi, welcome to part 4, the last of the mini lectures for Introduction to Health Promotion. I'm going to be going through a couple of case examples from my practice and research and providing a summary. So I'll just flick to the slides. Okay, case studies, health promotion in action. So what does this actually look like in practice? Headspace Youth Mental Health Service is an organisation, a national organisation that's been operating for a few years now. It's a federal mental health promotion initiative. I worked in Headspace for 2 years as a private practitioner. The main aim of Headspace is to work with young people with mild to moderate mental health difficulties. So they may not have a diagnosis. They may be experiencing some anxiety, depression, self-harm, eating problems, self-image, self-confidence problems, but they don't necessarily need a diagnosis. And in that way, they're very well set up to get in early, I suppose, work with young people who are starting to experience some issues, but are not yet at the treatment end of the spectrum and require an acute or long-term mental illness service. So the main aim of Headspace is to offer health promotion, and they do this in the community with school groups, sporting groups, anyone who puts in a request. They also offer education and prevention with each young person that accesses the service, and also with families. The age group that Headspace works with is 12 to 25 years. And the aim of that is to work with young people at a very early adolescence, again, to help prevent a long-term illness. They offer primary care services, so not just mental health services, but they also have GPs who can help with sexual health and contraception or any other health issue that young person might have. And again, that's about preventing long-term illness. And there is research that demonstrates that people that may meet a diagnosis classification for some conditions can improve and no longer meet that classification for that condition later on if they access treatment early. And that's the idea of Headspace. So from an occupational perspective, Headspace provides community education to support young people to participate in health promoting behaviours. They provide a pathway for early intervention to prevent illness. They provide support to schools to create supportive environments for young people with mental health issues. And they also help out with other issues that affect a young person's participation in occupations, such as gender and sexuality or physical disabilities. Headspace has a range of health promotion initiatives and programs and online resources. And if you visit their website and their YouTube website, and the link I've provided online will help you access that, you can see their range of health promotion videos they've made to help educate the community about mental health conditions and how they're experienced by young people, which is quite different to how they're experienced by older people or adults. They also have a range of ambassadors to help reduce stigma, which is really interesting too. So make sure you have a look at those different health promotion approaches that they use to get a good idea of how Headspace uses this approach in practice. Community Food Centres Canada, they're a national organisation across Canada. They have around 5 community food centres in different cities and regional centres. The one that I visited was in Toronto, and I visited the Community Food Centre there as part of my research, my PhD research project, to look at how the community participates in a community food program. And their community food programs included community gardens, which is in the picture there, a community food market where they had lots of different stores that people could run within the market and sell their food. So it was set up as a social enterprise where people could make a profit from selling the food that they had grown. They also run cooking skills groups, school groups to provide nutrition education. The community food centres are based on the principle that healthy food is a basic human right and that all people should have access to cost-effective, healthy and culturally appropriate food. They also were built on the principle that food banks are insufficient for persistent problems of poverty and poor health. So again, in this space, food banks are seen as a treatment, and they're trying to work on prevention. So prevention being community capacity building, access to healthy food, nutrition education. All of those things are health promotion strategies that will help people to stay healthy rather than getting to a point where they're reliant on food banks and not able to take care of themselves. From an occupational perspective, this initiative improves access to education and work pathways because a number of people involved within the centre were also doing Certificate 3 and 4 training in agriculture. Some were also doing training courses in advocacy, political advocacy. From an occupational perspective, people were involved in gardening and physical activities, which was a health promoting activity, skills development, community capacity building, cooking and food preparation. And they experienced a number of benefits from participating in these occupations that helped to promote healthy living. Some of the outcomes of the program that promoted health were social cohesion, having a green space that people could go along to and hang out in and meet other people, nutrition and health literacy, improving their gardening skills, and engaging with different training opportunities. So the main principle of the Community Food Centre was to promote health through food. The third example is the Bromley by Bow Centre. This is a centre that's located in East London, and if you look on a map, it's sandwiched between two railway lines. So quite an unfortunate place for a community to be located between. They have a very high immigrant population and a very low socioeconomic status. So this health centre was built 27 years ago, maybe a little bit more now, and it's a really effective model of how you can build a primary healthcare centre on health promotion principles. So the focus of this centre is to provide services that prevent chronic illness and reduce the impact of the social determinants. Their key aim is to build a healthy community. Their programs are for education and employment, not just GP visits, but they do also have GP clinic there with allied health. They have people who act as advocates, and some of those people were once clients themselves that have moved through training pathways to become peer advocates. They also have a community art and enterprise program where people can produce different things and sell them to raise money for themselves and their community. They also operate on a volunteering and time bank way, so people donate their time to other people and share their skills, which is a really great way of strengthening community action, one of the Ottawa Charter principles. So by focusing on prevention, early intervention and education for chronic conditions, they're helping to reduce the impact on tertiary healthcare services like hospitals and improve the health of communities so that they don't need to go to hospitals. This is a really great program, and I've provided a link to their website, and it's well worth just having a look around their website to see the different programs that they have on offer, and that might give you some ideas of different things that you might be able to implement as a new graduate. Okay, to the final summary stage of the presentation. So we've gone through the what, why and how of health promotion. The proposed outcomes of health promotion are summarised here. So we want to improve people's health education and their ability to use health information, which is called health literacy. We want to improve social cohesion within communities. We want to improve people's subjective well-being and their reported health status. We want to reduce people's reliance on medical and specialist services, which are very costly, and also, again, prevention is better than cure. So we want to focus on prevention rather than treatment services. By doing health promotion, our key aim is to improve people's quality of life, to prevent acute and chronic health issues, and to make sure people have good, timely access to health services and can navigate them appropriately when and if they are needed. So after going through all those points, I hope you are a strong advocate for health promotion, but when you are out in the community and in workplaces, you will come across people that don't believe in this position or don't think it's worth focusing energy on this approach. And you may feel like you're pushed into focusing all your energy onto your caseload and treating people rather than spending some of your time, at least some of your time, on prevention. And some of the comments you might hear people make are that if people are not sick, we'll lose our funding. And I would argue that that's not the most important thing. That's not our purpose as occupational therapists. We don't want to maintain program funding if it means that we're keeping people sick. We need to work on prevention. Another comment that I've heard someone make was that if we don't have a waiting list, we can't demonstrate the need for our service to government. Again, as health promotion occupational therapists, we need to focus not on our waiting lists, but on preventing people from needing to access that service in the first place. That needs to be our primary priority. Another comment I've heard someone make, why would we work with people who are healthy? And again, if we're only focusing our attention on working with people who are very, very sick, we're not doing anything to prevent people from getting that way in the first place. So if we work with people who are reasonably healthy, who might have some signs, symptoms, or some indicators that they might become unhealthy in the future, we can try and improve those conditions for them before they get to that very unsick end of the spectrum. Another comment I've heard people make are that the poor people will always be poor, and that's not our responsibility. I strongly disagree. I think the social determinants have a large impact on health, but there are lots of things that we can do to reduce their impact on people, and there's lots of things that we can do to try and improve the conditions in which people live. So hopefully you'll have some good arguments to fight back against people that might make some of these comments in the workplace. And in this I ask you, how will you be an advocate for health promotion, given that not everyone will advocate for this approach? And I want you to think about how you'll work with communities, organisations and populations to assess the needs and address occupational issues using macro level strategies. And I hope you take up this challenge. Here are my references for the presentation, and you'll be able to access these slides online and access those later if you'd like to click the links. There's another video here, Alfie the Tooth Fairy, which you may have come across before, which is a great health promotion video about healthy eating and reducing soft drinks for Indigenous children. An article here by Wood, Fortune and McKinstry details different perspectives on OTs who are working in health promotion, which is another good example that outlines the roles that OTs have with health promotion in primary care settings. That's the end of this lecture. I hope you enjoyed it, and feel free to forward any questions about this through the discussion boards on the website. Thank you.